This week in Wellness, we check out an amazing medical procedure that helps the body heal.
That's right. It's called stem cell therapy, and Megan Mooney explains.
Stem cells are what we call progenitor cells. They haven't differentiated into a specific kind of tissue yet. They have the capability to be told what to turn into. The blueprint's kind of the master plan, but they have the ability to do whatever they're told to do.
Dr. Shannon Ginnan of Living Health Integrative Medicine uses a cutting-edge procedure to jumpstart the stem cells into action.
So we're placing them in areas of injury, whether it's arthritis, degeneration of cartilage, damage to ligaments or tendons, soft tissue injury. We're placing them in areas that are injured so that they can get the signals to differentiate into those tissues and help regenerate those tissues that have been damaged.
Think of it as a natural power of regeneration in that it can prevent surgeries and limit the use of pain medications. So
patient comes in, we draw their blood, and from their blood we get a substance called PRP, or platelet-rich plasma. That platelet-rich plasma we use to sort of direct the healing.
Once the PRP is extracted from the blood, it's added to a portion of the fat that was taken from the patient. That fat contains the high amounts of stem cells that are needed for regeneration.
And then we spin that fat to enrich the stem cell load in that fat, then mix that with the PRP, and then re-inject that into the area that's damaged. Then we wait for the healing.
Dr. Chaney of Living Health Integrative Medicine became a patient herself, as her practice was already looking into introducing stem cell therapy to people who were having problems with their joints.
A couple years ago, my knee started to hurt, and I was working out pretty intensively, and it got to the point where I couldn't get out of the car from a seated position without pretty intense knee pain.
Dr. Steph had the procedure done over a year ago and tells us the stem cells regenerated her knee over time.
So I'm fully functional. I can go back to working out completely. The knee pain is gone. The tears have healed up, and we're back to normal.
She opted not to rely on hyaluronic acid or cortisone shots to get back on her feet. She says there's a difference between pain relief and regeneration and repairing.
And so the hyaluronic acid is like WD-40 for the joint, so it creates a lot of glide, and that can give patient relief if there's rough areas that are rubbing on each other in a joint. But I had tears, and the hyaluronic acid is not going to fix the tissue. The cortisone is an anti-inflammatory, so it will reduce pain, but it's not going to regenerate or repair anything.
And Dr. Steph says that with some of the older pain relief methods, you may have comfort in the short term, but then years later, you could have aggravated the joint to the point of quicker degeneration.
So that was not a good long-term solution for me. Surgery is not a good first choice for me either. I try to prevent surgery as much as possible. So this was the most natural medical procedure that I could think of that would make sense for me.
And if you would like more information and to see if you're a good candidate for stem cell therapy, call 410-216-9180 to schedule for the next stem cell regeneration seminar. That number again is 410-216-9180. And we'll check back in with Megan Mooney, who's